3 1s are 3, 3 2s
Hi, good evening, everyone. Good evening, everyone. I'm thrilled to welcome you all for today's informative webinar on Truth Behind Anti-Aging Pills. Are they killing people? I'm Shabnam, manager at Mediversal Academy, and I have the privilege of introducing our esteemed speaker for the evening, Dr. Ayush Pandey. Dr. Ayush is MBBS MD, FCCS USA, FIM, FPC, FNIV Spain, AASC. Dr. Ayush is a consultant physician, diabetologist, and pulmonologist based in Bhopal, currently working at CMCH and Mansarovar Diligent Care Hospitals. He leads the palliative care unit at CMCH and is trained in palliative medicine from the Institute of Palliative Medicine, India. A passionate digital health educator, he has created 500 plus medical videos and built a YouTube community of over 1.5 lakh followers. Dr. Ayush is pursuing the executive program in healthcare management at IIM Shillong and collaborates globally as faculty with the University of Buckingham and as a medical consultant with healthcare firms in US and India. Over to you, Dr. Ayush.
Thank you so much, Shabnam, for the very warm welcome, and I hope my voice is audible to everyone.
Yes, doctor, you are audible.
So once again, thank you, Shabnam, and it's been a pleasure to conduct, sessions with Team Mediversal. It's the first session, and it's great to be on board. So today's topic, is my screen visible? The presentation which I'm sharing.
Yes, it is. It is, doctor.
Okay, so I'll just put it on the slideshow mode. So the topic for today's session, very clear, and I think everyone must have seen news in the recent times that there has been a death of a actress, and we'll be discussing this also in the webinar. So I'm Dr. Ayush Pandey, has already discussed my brief intro, so I'm not going with that. So let's start with the presentation, and I welcome you all of you. So the topic for today's session is truth behind anti-aging pills. Are they killing people? So there has been, a boom of anti-aging pills, medications, IV, oral, everywhere supplements you'll see, and people are running after it. People want to, especially actor, actress, social media influencers, and now, in fact, in the general population also, you'll see that there is a trend of going for this therapy, anti-aging therapy. So are they really safe? What exactly is, what are anti-aging therapy? What are the effects? What are the side effects? We'll be discussing this. So let's start our presentation. So what exactly is cosmeceuticals, cosmetics, and drugs? So these are three different terminologies, and I hope that you must have come across these words very frequently. Now, even in the social media, you get a lot of promo, you get a lot of promotions of this creams or this kind of pills which will let you glow more, which will hide your wrinkles, which will let you get your aging, which will decrease your aging, which will prevent you and make your skin glow more. So all kind of that gimmick products are there in the market. So what exactly is a drug? So what drugs is substances used in the diagnosis, prevention, and treatment of disease, and these affect the structure or function of the body. So US FDA, that is the Food and Drug Administration, has clearly given the definition that anything which is used in prevention or in the treatment of disease which causes the change in the structure or function of the human body is to be named as drug. What exactly is cosmetic? So substances applied to the human body, and for what purpose? For cleansing, beautifying, promoting attractiveness, or altering the appearances. So this is exactly, the cosmetic which is there in the market and which we come across each and everywhere, and every place is, just flooded with this cosmetic products everywhere. You go online, you go offline, and they are selling like, havocs. There is maniac in the market with this cosmetic products. So unlike drugs, cosmetic do not change or affect the body structure or functions. So anything, claiming that they will change they will reverse your aging, they will let you look 10 years younger, they will change your genetic makeup, and everything is all bogus, is all, gimmicks which are there. They do not change any change in the body structure or function which is being done by the cosmetics. So what exactly the types of cosmetics which we have are the decorative and skin care cosmetics which we have. Talking about skin care, because this is exactly the trend in the market. So skin care are moisturizers, sunscreen, which every one of us use on a day-to-day basis, products to repair or hide imperfections like acne, wrinkles, dark circles under the eyes. So they can help in clearing your acne, somewhat repairing your wrinkles, or clearing your dark circles. But again, they do not affect or they do not alter in the genetic makeup or the functioning of the body. This has to be very clear, and this is the clear cut definition differentiation of cosmetics from drugs. So as we discussed in the first slide, cosmeceuticals. So this is again a term which has been set up by the cosmetic industry, but FDA, that is the Food and Drug Administration, doesn't recognize any category known as cosmeceuticals. So a product can be a drug or a cosmetic, or it can be a combo of both, but the term cosmeceuticals has no meaning under the law. So this is again, just something to sell the product just for promotion purpose, which has been brought up by the cosmetics industry in the market, but there is nothing as such as cosmeceuticals. So substances that have characteristics combining the aesthetic appeal and benefits of traditional cosmetic with therapeutic component, but exactly it is not a drug product. But again, I will tell you that this is just a term which has been given by the cosmetic industry. So what are these anti-aging products which are there? So cosmeceuticals contain active ingredients which are there in the market, and they sell by this, that they have vitamin A, vitamin B, C, E, and antioxidants. They have enzymes, they have phytochemicals, they have essential oils which will, enhance your skin, which will let your skin to glow more. So when applied to the skin for an extended period, they, they increase the skin hydration, and that is exactly the role of moisturizers. So you apply to a rough skin, what exactly they do? They provide hydration. Your body is lacking in water, your body lacks hydration. So this effect is being provided by the moisturizer. So water can cause the excretion of cytokines, therefore alone may alter both the structure and function of the skin. So what are these moisturizers with antioxidants? So it helps to boost the skin's natural defenses, can restore a smooth appearance if your skin is dry, rough. So it will, because it provides a good hydration, so it will improve the dry, irritated skin, and it will help you to build that normal appearance of this skin. So what are these modern sunscreen products, which I think every one of us use on a day-to-day basis? It comes with biologically active molecules which provide photo protection, that is protection from the sun, from the rays, harmful rays, through their capacity to prevent some of the biochemical and molecular consequences in the skin after UV rays. So antioxidants, osmolytes, DNA repair enzymes are there in the sunscreen, and it protects at least from harmful UV rays. It builds a layer, it builds a coating to your skin, so it prevents that harmful UV rays to filter your skin and cause the damage. So now this again you'll see, and I think you must have seen that anti-aging serum with collagen. So what exactly is the truth? So collagen, exactly when you administered from outside, any collagen, it does not penetrate the skin, and it is a fact that any collagen administration from this outside, but collagen building is there from the inside of the body. The body self produces collagen. So there can be methods to self-produce, and that is exactly by repairing your immunity. Building of the immunity has to be done neither by just applying the collagen on the skin or on the face that will help you to look 10 years younger, or it will alter the skin structure, or it will change the collagen structure. So what exactly? So various proteins has been added, and again, you must have seen that this is the keratin product, this is the collagen, elastin, and everything. Peas, soy, wheat, oats, fish oil has been added. So these are the products. These are the chemicals which are being added. Various protein source, especially a strong source of protein. So what exactly happens when you apply this? So when dry over the skin surface, the skin underneath contracts, and that fine wrinkles over your skin becomes invisible. So when you apply this, I'm sorry. So when you apply this on your skin, it will hide that fine wrinkles which will there, and it will become invisible. That doesn't mean that your wrinkle has faded. It has just formed a coating. It will help in some building up of the structure, some treatment of the wrinkles, but 100% or changing in the genetic structure and focusing this again and again is not being done by this cosmetic products. So creams, again, water creams, semi-solid dosage form containing one or more drug substances involved, dissolved or dispersed in a suitable base. So it comes in a base form. So they are semi-solid emulsions of oil and water. They are of a softer consistency. So if you apply cream, they are not rough, they are of softer and lighter than the true ointment. So if you see the consistency of an ointment, just like a ointment which you apply for the pain, and if you look the texture of the creams are much softer as compared to ointment. So because of this oil and water combination, it makes it soft. So semi-solid are of two types: oil water and water oil combination. So what is exactly the aging skin? What is exactly it is? So skin aging is characterized by progressive deterioration of the skin's functional properties linked to alteration of the dermal connective tissue due to changes at the cell, gene and protein levels. So with age, your skin deteriorates, your each and every body organ declines with age. Its function, its consistency, its overall build-up declines because there is a lot of genetic changes which is going on at the cellular level. So skin aging can be divided into intrinsic and photo aging. Intrinsic aging is natural and it occurs due to passage of time. With age, as the age increases, there is intrinsic aging and you cannot stop it. There is no ways. A lot of research is being going on, but it is yet, we are, and you see that in Germany, I'll tell you what they have now. They are doing it. They are preserving the dead body in the view that a later research, when it will be, they are hoping and they are charging million and million rupees for this, that preserving of the dead body. So the basic role, the basic thought process with them is that any research will come and they will revive that dead body and that dead will become alive. So they are preserving in that all lot of chemicals. If you look into the Google, it is very popular in Germany, and but it is charging a lot. So many of the billionaires, millionaires are preserving their relatives or loved ones' dead bodies in the view that at a time the research will be developed so much that dead will come back alive. So we are in the process of that. A lot of research is being going on that we can reverse aging, we can reverse it 20, 30 years less, but again not 100% yet achieved, not 100% success. So intrinsic aging, again influenced by genetic factors, oxidative stress and cellular senescence and its consequences. Photo, as by the name suggests, due to the effect of solar exposure on the skin through pollution, and again diet and smoking and alcohol acts as the contributory factors for your skin aging. So with effect of age, as the age increases, what exactly happens to the skin? It becomes rougher. There is development of lesions, and there can be benign lesions development over the age. Skin becomes slack. If you see your loved near and dear ones, dadi, nani, their skin becomes very loose. It loses that elasticity, And that causes the skin to become so loose. Skin becomes more transparent, pale. There is thinning of the layer of the epidermis. Skin becomes more fragile. So when a slight, a pressure on this can cause a bruise or something, and there can be cut. There is flattening of the area of where the epidermis and dermis come together. Skin, as I already told, very easily bruised, and there is damaging of the blood vessels. It is because the skin is, losing all the genetic makeup. There is breaking of the bonds, breaking of the collagen with age, and you cannot stop it. So this exactly happens as the age progresses. There is receding hairlines, forehead lines, frown lines, drooping eyebrows, crow's feet, very common, under eye wrinkling, hollowing of cheek, deep nasolabial folds, sagging, drooping angle, marionette lines, and chin becomes to recede. There is receding of the muscles, subcutaneous fat and tissues which is there, and it is a normal physiological process. Any creams, any cosmetic products claiming to reverse all these is not there, and you are falling in that, trap, and you are buying the product just seeing a Instagram reel or any social media reel claiming to reverse or claiming to uh, reverse aging or so. And this is again all a myth. I'll tell you one example that there is a cream called as Gora karne wali Fair and Lovely along with. So earlier they used to claim, they used to portray themselves. They brought an ad that, they will make men, Fair and Lovely men, they will make men and women fairer, complete fairer, and even the black or a whitish skin will become, complete white, or will become, it will be reversed. So men started using it, women started using it over a period of time, 1 month, 2 months, 3 months, over a period of year. There was ultimately no change. So some of the men or some of the people went to court claiming that the ad was there to reverse the skin color, to reverse the changes in the pigmentation or the texture of the skin, but there is no response. So the court held this company responsible, and they were allowed to pay a lot of rupees in lakhs to the customers. So now if you see any of the ads, they do not claim that, they will reverse the, or they will change the color of the skin. So anti-aging cosmetics again they deal with the removal of aging and wrinkle effect on the skin, but they are predominantly moisture based, and again marketed with the promise of making the consumer look younger by reducing, masking, or preventing signs of aging. Definitely masking and preventing signs can be there. So anti-aging, again, emerging class anti-aging ingredients, they can help to reduce some fine lines and increasing the moisture level. Definitely, this is being achieved. A good hydration can be achieved. Some antioxidant properties can be achieved. So signs such as laxity, writhings, wrinkles, photoaging, which includes erythema, redness, some pigmentation, yellowing, keratosis, abnormal growth, and poor texture. So some signs can definitely be reversed with this, but again, 100% claim, and all thing is hoax. Can can you mute someone talking in the background? Can I go ahead?
Yes, doctor, you can.
So this is the magic of anti-aging cosmetics you see, and again the ads are also portrayed in that form only. So what are the best anti-aging agents? Definitely retinol, again, derivative of vitamin A, soothes wrinkles and clogs pores, lightens your some brown spots, improve the texture. Definitely it can be applied uh, at night also, or in direct sunlight. Niacinamide, again, dark spots from acne, scars, sun damage, again, lighten because it is a vitamin B3 derivatives, and that prevents melanin pigmentation. Hyaluronic acid, again, common. Humectant, allowing, meaning that it draws out water from the air. And dermis, so that skin that lies below the surface. Alpha hydroxy acids, again, exfoliators that gently dissolve the glue that holds surface skin together, letting the deadline to reveal youthful looking skin. L-ascorbic acid, again a vitamin C antioxidant, helps in building collagen to some part, reduces inflammation, yes, promotes elasticity to some part, avobenzoin and antioxidants. So where benzoin, again, it is there in the sunscreen with SPF 30 and commonly chemical ingredient that blocks UVA rays. So antioxidants prevents and repair damage to your body by encouraging cell growth. The most popular antioxidants are vitamin C, E, pomegranate, and coffee berry extracts, and again commonly. So this is the skincare formula, natural ingredients, and just for example, so Tonaderm, and they come up with acai, pomegranate, mangosteen, green tea, again noni. So green tea again, people drink also because it is a good antioxidant. Yes, and to some part helps in skin hydration and prevents UV aging. It prevents from the UV rays. Noni contains fatty acids. Acai contains berry again antioxidants and contains fatty acids. So it helps in some removing of that destructive free radicals. And collagen again, it helps in preventing that fine lines. Pomegranate. So talking about this, Neutrogena, I think it's a very common product. Just for a reference example, what it contains. So ingredients, as you see, what are the ingredients in this product and what exactly is the function of this ingredient. So if you look at the ingredient and if you look at the function, most of the functioning are, if you look at conditioning, anti-foaming, humectant, abrasive, film coating, pH regulation, antibacterial. So most of the functions is this only, not just changing the genetic makeup or so, but changing the but providing a good hydration, providing conditioning, acting as an antioxidant, some part of pH regulation, and yes, some part of antibacterial. So this is exactly the marketed formula. Garnier, again, one common product. So the ingredients in this, they claim this retinol to be anti-aging, but again, as I already discussed, what exactly is meant by this anti-aging? It doesn't mean that it reverses your skin genetic makeup. Just it treats dry, rough, scaly skin, acts as a moisturizer, skin conditioning, acts as a good absorbent, antibacterial, some part of antioxidants, anti-inflammation, and waterproofing. So most of the functions is providing a good tone, providing a good water, providing a good hydration to the skin to make it look better. So coming to this case, as I already told in the before starting the session, and this has been in the news all where you must have come across what happened, what exactly happened to this. What she was on anti-aging medication. Yes, she was taking IV glutathione, and suddenly it occurred a cardiac arrest. So what's the link? What happened to Shefali Jariwala? What was the cause of this actress? So she was on anti-aging medications from last 7 to 8 years. Yes. So on June 27th, there was a ritual at her home. So this actress was fasting for that ritual. But during the fasting also, she was on IV glutathione therapy. So she took an injection of this IV glutathione in the afternoon of the same day, and she has been taking this treatment every month of this IV glutathione. So the forensic science laboratory expert discovered this glutathione vial at her place, vitamin C injections, and some acidity pills and skin whitening products at her place. So what exactly is the glutathione? So it is an antioxidant, yes, produced in cells, composed of 3 amino acids, glutamine, glycine, and cysteine. So as your age increases, the level declines with age, the level of the glutathione. So as by the name suggests and by the role, it is an antioxidant. It helps to prevent that oxidation of your skin. So it helps, as again, they claim that it helps to prevent aging. So it works by reducing melanin levels and improves skin texture. So the basic function of the glutathione is not changing the genetic structure of your skin, but it works by reducing the melanin level. So melanin level decreases, you glow more, you look more fairer, and your skin texture improves. So Shefali was on this therapy and she was taking from 7 to 8 years. So a study published in Curious Journal indicate that oral administration result in significant but again variable reduction in melanin levels with limited side effects. So oral glutathione, so every pill, whether you take oral or you take IV preparation, there are effects. So even a paracetamol has its side effect. So everything comes with a side effect. So, but oral has comparatively lesser side effect than IV. So IV carries serious safety concerns. So IV administration can cause anaphylaxis, a life-threatening allergic reaction. It can also cause hepatotoxicity, liver damage due to toxic substances, and risk further heightened by a lack of standardized dosing protocols. So there is nothing kind of standardized dosing protocols. They say that 600 to 1200 milligram of glutathione in a week can be taken, but again, standard guidelines is not yet being set. Even FDA is dicey on this part, and the role of glutathione is again controversial because reducing melanin levels to some extent in some of the patients and to even nil extent in majority of the patients. So still a lot of trials and studies are being going on, but several factors must be considered along with this, such as if you have a pre-existing any health condition, diabetes, hypertension, any cardiac neurorespiratory disease, any genetic heart issues, your lifestyle choices and smoking habits. So this also play a very important role. So taking medication without food can have serious consequences. But we take some medication without food also, just like thyroid medication taken early morning, empty stomach. But the medication which is prescribed to take after food, there is there is a reason for this, because when you take stomach empty, its lining is more exposed and it is sensitive. The stomach is sensitive. So certain medications like anti-inflammatories, steroids, and some supplements cause irritation or worse. So you see that if you take a paracetamol and empty stomach or so, you get gastritis. A lot of persons get. It is because of that, thin lining that cause the damage to the breach to the epithelium of the stomach, and thus that causes irritation, and it can get even worse. So there can be low blood pressure, dizziness, fainting, or even cardiac complications, irregular heart activity. And so this exactly, the reports are yet to come out in Shefali's case, but as per the reports that has come and as per the studies which say that she must have taken she must have taken medications empty stomach. Because of that empty stomach, taking of the oral pills along with IV glutathione, it got absorbed into the circulation early. So early absorption led to cardiac complications leading to low blood pressure, even irregular heart activity, and that caused the cardiac arrest of the actress. So these symptoms are even more likely when several medications are taken at once, a condition known as polypharmacy, combined with a lot of medication. So what exactly you can do, what can be done if you really want to go for a anti-aging so-called treatment, or you want to take any kind of pills or supplements also for your skin or so. Consult your doctor, get a professional skin assessment done, because the genetic makeup of each and every individuals is different. You need to understand this just by seeing the ad, just by seeing the promo in the social media or so, and by taking the pills. Every pill, every medication has a side effect. So you need to get your skin assessment, what exactly is right for your skin, whether it is needed or also not needed. That is more important. So that testing has to be done. Be wary of marketing hype. So do not fall in that trap of that gimmicks which are there. Consult a doctor, consult a dermatologist, consult a skin specialist, consult a plastic surgeon, consult a doctor. Check for certifications and approvals. So every pills, every that creams which are there, that certification. Talking about the US, there is US FDA. Talking about India, there are a lot of boards are there, ISO and so everything. So all that safety checklist is being there at the back of your creams, any kind of the products which you use. So check for that approvals, whether it is approved or not approved, what is the expiry date, what is the manufacturing date, what are the contents of it, whether it contains, natural products, whether it contains steroidal product. So everything is there. And if it is not there, then, something is definitely fishy. Know the ingredients and their effect. So you have to know what is the ingredient in that product and what can be the side effect of this. If you are confused at this level, consult your doctor. So your doctor will only prescribe you this, but even if you want to use this, all kind of moisturizers or so, use a standard brand product or so. But again, you should know what exactly is the ingredient. Even you can check on the Google, but again, check for the authenticated and trusted source. You can see what exactly is the ingredient with the product you are using. So you look for the ingredients. You also understand what can be the side effect of this. Using it for a long time, how much period you want to use, what can be the side effect of this. Don't skip the patch test or trial phase. So if you are really want to go for skin treatment or so, your doctor will advise you a patch test. What exactly is a patch test? So patch test is basically to check out for your skin sensitivity. So wherever this patching is being done with allergens, which are there most commonly. So in our environment, there are most common 70, 80 allergens are there. Some doctors even, let you do patch test with 150, 120 allergens. So most common allergens, and it can be food products, it can be it can be vegetables, it can be, animal danders, any most common allergens which you come across. So if you do a patch test and that allergen is being put into your body, either through patch test or a skin prick test, that area will become red through where that allergen is being applied. So that means that you are sensitive to that allergen. So you can't use it because your skin will get irritated when coming in contact with that allergen. And I hope and I, believe that most of them in the webinar also, you must be having allergy to some or the other products. Yeah, coming in contact, you must be having sneezing, you must be having eye irritation, inflammation, even shortness of breath, skin itching, inflammation. So these are due to the common allergens. Verify the credentials of your practitioner. Again, important, you have to see because a lot of quacks are there in the market. And everyone is claiming that they are, cosmetologists, they are, trained in everything, they are skin specialists or so. But what exactly is the credentials? The news has come that, hair transplant is being done by a quack and the patient died. Why? It is not that risky procedure, but again, done by the untrained professional, untrained unsupervised, you don't know what can be the potential side effect and how to tackle those. So you go to a quack. Why? Just because you compromise quantity over quality, because that quack offers that, procedure or any kind of thing at a lesser amount. Maybe they offer and they claim, they portray themselves that, they will get your skin treatment within 7 days, within 10 days or so. But again, you have to verify. It is very important and assess for the long-term safety, not just short-term results. You don't just fall into the trap of short-term results. Look for a long-term safety. So what can be the natural ways to reduce aging? We have seen a lot of products. So, but products, you can apply products, and these products are expensive also. They are not that, if you look out for even moisturizing cream of a standard brand, it comes for around 400, 500, 600 rupees. So using it, for every month or maybe every 20 days, you have to buy a new one. It is expensive. So what can be the natural ways? Natural ways are, a long term, it is a sustained treatment, but definitely if you follow this, if you stick to this, you will see the change. So have a balanced diet, a diet rich in fruits, vegetables, lean proteins, and whole grains. Drink plenty of water. Your skin is dry, rough. What it needs is hydration, plenty of water. Regular exercise is important. Let your skin sweat, let your skin breathe. So, that will help in unclogging of pores and it will help to even synthesize new collagens or so. So, regular exercise is very important. Prioritize sleep. Many of us, sleep late in the night, 2, 3 a.m. Many of us sleep for just 4, 5 hours. And you see that, nowadays people are getting neural issues, cardiac arrest, heart attack. Why it is happening? Your body is not getting enough rest. You're not sleeping properly. You're not eating properly. What you're eating is full of maybe chemicals or synthetic products. Avoid this smoking and drinking. This side effect, this damages your skin, this damages your whole body, and it slows your metabolism. So, the truth behind anti aging pills is that while some supplements may offer benefits for overall health and potentially slow down some aspects of aging, there is no magic pill. definitely to stop or reverse the aging process entirely. It is a natural phenomena. Aging is a complex process influenced by genetics, lifestyle, and environment. You can't stop it. So hereby I end my presentation and open to any Q&As. Thank you so much.
Thank you, Dr. Ayush. I request everyone to write their questions in the chat box. We'll start the Q&A session. So Dr. Ayush will answer one by one. Please write down your questions in the chat box. Meanwhile, I'll be sharing the certificate registration form in the chat box. Please do fill the form to get your certificates in your mail ID. So Dr. Jyoti is asking how to reduce free radicals in body.
Free radicals, as I already told, that natural methods of aging, you can follow that. Definitely eating good amount of vegetables, green leafy vegetables, and the important part, fruits, and so they are natural antioxidants. So the role of antioxidant is prevention of that free radicals. So free radicals are that damaging component to your skin and to your body. So if you go for a natural therapy to prevent that free radicals let damage your skin, damage your body, just choose this, have a good amount of water, have a good amount of green leafy vegetables, have good amount of fruits. And fruits, you can take pomegranates are very good source of antioxidants. You can have apple, you can have watermelon, you can also have papaya. So these are, definitely a natural source, and it will definitely help you to take all that free radicals. I would definitely not advise to take any kind of pills or supplements that claim that, they reduce free radicals in the body.
So we have another doctor here, Dr. Twinkle. They are asking, nowadays so many brand tropical serum available. What is exact role, sir?
Pardon, can I have the question just again?
Yes, doctor.
So serum, see, a lot of serum is there. You get a lot of hair serum products also. You get a lot of face serum products. So the basic role of any cosmetic products, just be clear in mind, provide a good hydration, provide a good conditioning. If your skin is dry, rough, it will make that moist. It will provide some kind of antioxidation. Some can be a good antibacterial source also. But do check the product. Do check the specifications of the product. It is there at the backside of the product. Do not just buy any gimmick product which is there in the market, but the basic role of serum is not changing the genetic structure of your skin. They claim that they will vanish all your wrinkles, your skin will become all that tight, and everything will be clear, you will look 20 years younger. All are full of these are all full of gimmicks and all false hopes. So the basic role is complete hydration. You can use definitely if it is standard, if it is a good product, you can definitely use it. But do check for the composition, do check for the standard brand which is there, and do check for the composition and the all the details which is there at the backside. But again, if you want to go for any chemical products, synthetic products, do consult your doctor. If you are really looking for, a long-term therapy with your skin, if your skin has lot of scars, lot of acne, lot of damage is there, and you are looking for a long-term treatment part, do not just use any product which they claim that they will vanish all your scars, they will vanish all your acne. At the end, you will get a bad reaction to your face, because you have to understand what exactly is the sensitivity, what exactly your skin texture is, what exactly is the composition of your skin, and that will be let you know by the doctor only. The doctor will run a couple of tests and will let you know, and will prescribe the products accordingly. So looking for a short term gimmick products rather than long term commitment, you shouldn't fall in that trap.
So Dr. Richa is asking, any tips on the usage of sunscreen? Should we advise on their use?
Yes, sunscreen definitely advised. It should be, as I already told, it blocks, it helps to prevent that, UV rays, because UV rays are harmful rays. And that's what, we have a ozone layer also. What exactly is the role of that? The role of that is preventing that harmful rays coming to the earth and coming to if there is no ozone layer, we all will get, skin cancer and everything, a lot of all that things happening to us. So that acts as a natural filter. But sunscreen, if you apply, if you have a lot of sun exposure on a day-to-day basis, apply a sunscreen, any kind of SPF 15, 30 will work. So if you apply it, that will form a barrier that will provide a good hydration, a good conditioning, and it will prevent that harmful UV rays from filtering that skin. And it will definitely help also to build, helping in build of the texture of the skin. So it is definitely advised.
Okay, so Dr. Rabia is asking, what about glutathione physitabs DT? That would be better any day, right?
See, as I told, there is no guidelines yet has been set by the in fact US FDA, and there is no control body in India. Very sad to say that these products are being just by reversing this, ये हो जाएगा, ये लगा लो, ये हो जाएगा, this will happen if you apply this. So there is no standard guidelines which has been laid by any body in India. In fact, there is no standard body which has been set to regulate these role of cosmetics. There is of course, pharmaceutical association which look after the drugs and so. But sadly to say that, all kind of these products, if you go for a tablet treatment, if you go for a IV treatment with glutathione, they have a role in reducing melanin levels to some extent. But again, it varies from genetic makeup of the individual. It is not a cheap treatment. It is expensive treatment. It is not a cheap treatment, and you won't get miracles in days. You have to go for months, even for years. As I already told, discussed in the Shefali's case, she was on this therapy since 8 to 10 years. So it is expensive treatment. It is expensive modality of approach, but again it is controversial also, because even after 5-6 years of age, there are high chances you won't see any result, and you will say that I have spent lakhs of rupees. Why have I spent? My doctor has bluffed me by saying that everything will get reversed. So you have to understand this, that there can be slight reduction in melanin levels, there can be no reduction, even if you take oral, if you take IV, but it is again based on complete genetic makeup.
Okay, so Dr. Chakradhar is asking, is sunscreen a mandatory part of skin routine in case does these chemicals in these products have other side effects?
See, if you are exposed to more sun exposure, a lot of people work in open environment, open air fields. If you have a lot of sun exposure, what exactly is your barrier to protect that from sun? If you have a dry, rough skin, if you have a normal texture, if you stay most of the time indoors, if you eat a good healthy diet, if your skin is hydrated, there is no need. Definitely, I'll tell you. But if you go more out in the sun, your skin gets red by sun exposure, phototherapy photo aging kind of phenomena is there. You get lot of more exposed to dust and so then it is definitely advised. Why? Because even if you cover yourself with clothes, if you wear a full sleeve shirt, or if you cover with, some part of your body will get exposed. But ultimately you can't pack yourself throughout. But you can't just pack yourself throughout the body. Some of the other part will get exposed to sun, and that will lead to, that damaging effect to your skin. So if you are a more outside worker, more sun exposure, more photo exposure is there, more light exposure is there, yes, for sunscreen is definitely advised. But if you stay indoors, if you eat a good healthy diet, if your skin is hydrated, then again, no specific need is there for this sunscreen product.
So Dr. Sanjeev is asking, what about acetylcysteine and coenzyme Q10?
Again, these are antioxidants, and acetylcysteine and coenzyme. These are antioxidants, and again, as I already told, the role of antioxidant is prevention of that development of free radicals. Free radicals will attack your skin, will scavenge it, scavenger, just like we call it vultures and we call that jackal scavenger. What scavenging is? खाना, आपके स्किन को खाना शुरू करती है, that free radicals. So to prevent that free radicals to damage your skin, they act as antioxidants. So rather than relying on these chemical supplements, I would say that go for a natural therapy. If not, If you are really fond of going this, again, it can have side effect also. They are not 100% effective because acetylcysteine is a very strong gastric irritant. It causes a मतलब तगड़ा वाला gastritis. So N-acetylcysteine has a couple of side effects. But again, if you really, if you are really if you are really fond of going for this antioxidant therapy, do consult your doctor, do consult a trained physician before, starting this or before taking self supplements of these pills also.
Dr. Jyoti is asking, does red light therapy works to slow down aging?
It doesn't, let you slow down aging. As I already told, any kind of product will not, change this aging process. Agar aisa hota, so, no one would have, even the 100 years people also will have that fair skin. What you see to the actor, actress, they are dressed in so much makeup and all that cosmetic products. आप शाहरुख खान का देखो या किसी का भी देखो, you just go and if you see them, just type their, normal appearance of Shah Rukh Khan without makeup on the Google. You see that a lot of wrinkles is there. You see all the actor actress. So they are, popped up with all kind of cosmetic products. Then they look, young. But yes, red light definitely it can help to build that some collagen, some makeup of the skin, but it will not slow down or it will not reverse aging. It will definitely not. It will have effect. Yes, it can. But again, it is not a cheap treatment, I tell you. इट इज अ लॉन्ग टर्म गोल, इट इज अ लॉन्ग टर्म ट्रीटमेंट कि ऐसा नहीं हुआ एक बार आपने ले लिया तो एकदम आपकी स्किन इट विल ग्लो, स्किन विल बिकम अ बेबी स्किन. इट इज नॉट सो. एजिंग इज द नॉर्मल फिजियोलॉजिकल प्रोसेस. यू हैव टू कीप दिस माइंड. एंड आपके जो द कॉस्मेटिक इंडस्ट्री इज सो क्लेवर, आई टेल यू, दे प्ले विद योर माइंड्स. उनको पता है कि आप किस ट्रैप में पड़ने वाले हो. They know that, by selling that they reverse aging, they slow down and all this shit, and so you buy the product and just unka role fulfill ho gaya. Then you use it for a couple of months, couple of years, and that things doesn't happen. Then you say that I will switch to another therapy which is there in the market, which is the new product, and they claim that I am better than the first one. Then you use it for a couple of years, then you fall into the third trap. So it is a vicious cycle. You doesn't come out of that trap only, and it goes for months, years, and so, and over the time you realize it, that which trap I have been fallen.
So Dr. Dattu is asking, what is the difference between dermatologically tested and dermatologist recommended products?
So dermatology recommended products means a dermatology can recommend as per his experience and expertise. He or she will tell you that, yes, I have used or I have advised my patients these products, so they have given a positive result. A dermatologically tested means it has been tested. All these trials has been done, because koi bhi product, if you see a COVID, vaccines. So vaccines trial was done on the individuals before launching them into the market for the normal population. So there are populations, हम एक population से group चुनते हैं. We choose a group of 10, 20, 30 individuals or so, and they give their consent for this trial. So based on that consent, the product which is prepared in the factory or anywhere, they are being tried on that. ऐसा नहीं कि एक प्रोडक्ट आपने बना लिया न्यूट्रोजिना, you have made that product, you have put out for the sale in the market. It doesn't happen like this. There has been a lot of, it goes through steps. So the trials has been done. When that trials is being passed, it has been tested, and that has shown some results, then it is out in the market to sale. So that means that it has been dermatologically tested on that trial population, and then it has been put out in the market. Dermatologist recommended means by मैं as a doctor, I have given these medications or these creams or any kind of products to my patients. They have given good results. So I recommend this based on my expertise, my experience.
So Dr. Twinkle is asking, hyperpigmentation over skin due to sunburns, is it reversible to normal skin color, sir? Please guide.
Just a second. My screen is not visible. Yes. Pardon, Shabnam, can I have the question once again? Hyperpigmentation.
Yes, I. Hyperpigmentation over skin due to sunburns, is it reversible to normal skin color?
It can be not to 100%, but yes, it can be reversed. It can be reversed because, if it has been it has become due to excess sun exposure, or, it can be might be due to any infection or so. It can be reversed because what happens in hyperpigmentation, there is more buildup of that melanin pigment in that skin. So to reduce that melanin, there are a lot of, in fact, medications. There are a lot of chemical, a lot of antibacterial or anti kind of viral medications are also there. So if it has happened due to this, it can be reversed. And if your skin is burnt, जब जली ही गई पूरी स्किन, why? Because of that, any kind of आग से हो गया, कोई trauma हो गया, कोई deep cut हो गया, then it is very difficult to reverse because that skin has become dead. So you can't reverse a dead skin. There is a dead skin, there is nothing, no substance left to reverse that process. So hyperpigmentation can be reversed, not to 100%, but yes, what किस वजह से हुआ है, that is more important.
Okay, so Dr. Dattu is asking, how important is the pH level of a skincare product?
It is very important. So every skincare products varies pH from 4.5, 6, 7, 8, 9. So it can be acidic or alkaline pH. So any kind of, so you have to look for it. So that, again, that is based on which kind of products, what pH your skin is sensitive to. And that is again, that patch test has been done to check out कि आपका skin acidic, alkaline pH किस pH के लिए, किस products के लिए more sensitive है. So if you apply a more acidic pH, that can cause more trauma. If you apply alkaline, again, that can cause. So the pH varies and it plays a very important role.
Okay, so Dr. Syed is asking, glutathione tablets can cause any side effects?
A lot of side effects. Lot of means the first important is again gastritis. There can be stomach pain, stomach upset, cramps, loose motions can also be there. Again, a bit of change in your taste in your mouth can be there, a bit of metallic tinge, and so these are the most common side effects. There can be, in fact, in some cases rash can also be there, allergic rash. So these are the side effects. So that's what I'm saying. Every pill, every medication has a side effect. You have to look out for it before popping in, before giving your body exposed to that medication.
Okay, so Dr. Ajay is asking, are clinical trials a must for a drug in derma segment if it's for local application?
Yes, any kind of product which is there in the market, a drug trial is necessary because even for local application, आप skin पे एक चीज apply कर रहे हो, you are applying anything to a body. You can't just something एक factory में कोई magic चीज बनी and you have started applying it. What can be the side effect? Whether it will burn your skin, whether it will cause rash, whether it will cause anaphylactic reaction. So a trial is needed, and that's what these cosmetics, any kind of even medications, antibiotics, all kind of paracetamols, any kind of thing. A trial is mandatory before throwing them into the market.
Okay, so Dr. Pramod is asking, what about melatonin? Is melatonin safe?
See, melatonin is a normal, your gland, pineal gland in the brain, it synthesizes melatonin, and melatonin is a good sleep regulating hormone, the more prime function. But again, melatonin tablets, again, they can be taken. But again, I won't recommend it on a long-term basis or on a day-to-day basis. If you are having that fatigue, weakness, if you have that disturbed sleep cycle, then again, melatonin can be advised. But again, there are a lot of natural ways to boost your melatonin intake. If you take a good amount of fruits, if you try to sleep well, or if you have difficulty in falling asleep, if you exercise good, your body will itself try to produce that melatonin. Good amount of exercise, quitting all the addictions of smoking, alcohol, and so eating good fruits, vegetables, your body will itself synthesize that melatonin.
So some doctor is asking, we have been using acetylcysteine in liver failure or hyperbilirubinemia along with glutathione and never seen such reaction, but we know it can happen.
Yes. So every reaction, definitely it can happen. So you have to check for it, because if you are using N-acetylcysteine, but N-acetylcysteine in liver failure or hyperbilirubinemia, what exactly is the role you are trying to, like, because N-acetylcysteine is an antioxidant. Yes. So again, if you are using it with glutathione or so, there can be a cross interaction. Drug to drug interactions are very common. So it can definitely happen. But as you already say that, it can happen. So try to use it cautiously. Try to look out for the side effect. Try to see that whether if you are using it, whether it is causing any harm or whether is there a cross interaction or so, or the purpose for which you are using it, whether it is being served or not. If it is just being used as a placebo, then it doesn't make any sense. So if the purpose is being served, if the patient is having a good positive effect, okay. But again, you have to look out for the cross interactions. Don't just, any medication shouldn't be used as a placebo.
So Dr. Syed is asking which brand is proved and best for derma section.
So this is again, a controversial question because every brand has effect and side effects. So I'm not a very fond or genuine of some brand because every brand they claim, different segments of soap. But if you are looking what exactly is the therapy or thing which you are planning to do, in fact, a brand which has passed all that clinical trials, which has all the, formulated composition of it for which it is being served and which is being standardized in the market with all the marketing compliance which it has been served, you can use it. So it doesn't mean that ki bhai Ayur ka hai to bahut ghatiya hoga, and if you are buying a Olay, then just for example, I'm not criticizing any brand, but if it has passed all the drug trials, if it has passed all the safety tests, if the compositions are fine, if it has certified, then again you can use it.
So Dr. Kelly is asking, can we use retinol, tretinoin for anti-aging skincare long term?
You can use, but again, if you're using it for anti-aging, this is retinol is a vitamin A derivative. The whole and soul thing is आपकी स्किन को न्यूट्रिशन कंडीशनिंग हाइड्रेशन देगा. स्किन की एजिंग को रिवर्स में इट डजंट मेक एनी सेंस. इट विल although cater some fine wrinkles or so, but बहुत if you are looking for some miracle treatment with it, then don't expect. Fine wrinkles, skin conditioning, aging, hydration, all kind of boost up, definitely it can be used.
So Dr. Nazia is asking efficacy of oral collagen, which type to be consumed when, and efficacy of vegan versus bovine collagen with bioavailability, natural source of collagen from everyday foods.
Natural source, as I already mentioned in the slide, and your question is definitely oral collagen, as I already told in my earlier slide also, it is something which your body synthesizes. आप बाहर से लगा लो, खा लो, that will not make much difference. And these are all, vegan, bovine, just marketing products जो आपको मिल रहे हैं. Just to sell out their products, because your body will itself synthesize this. And how your body will synthesize? You give just like एक car को एक good amount of fuel चाहिए run करने के लिए. Your body needs that natural fuel. Natural fuel is through right amount of food, right amount of vegetables. That's it. So oral collagen products, and so again, it is a very long term basis में आप if you see that कि oral collagen से आपकी collagen build होने लगेगी over a long term, don't expect that, definitely.
So Dr. Rabia is asking why the retinol should be used under doctor control, even topically.
Because it can have side effect. Everything, although it is a vitamin A derivative, but just retinol में अगर आप देखोगे तो सिर्फ retinol नहीं होता, retinoic acid, some kind of other chemical composition is also there. So if your skin is sensitized to that product, because it is a chemical product, your skin can get a rash, your skin can get a allergic to that. So आपको side effect हो सकता है. So definitely अगर if you are using it for a long term, just by seeing the ad कि भाई retinol use करने से things will get better, don't go for it. Whether look for it कि retinol is suitable for your skin or not, whether is your skin accepting that retinol treatment. If your skin is not accepting, if your skin doesn't suit, is not suiting to that retinol, you can have that side effect. So at least consult a doctor before starting for this kind of treatment, at least.
Dr. Afaullah is asking, sir, when do we have to start immunosuppressant medicine in eczema and in what condition is it given?
That is again, this is basically indicated in autoimmune conditions, which you have till immunosuppressants, because in autoimmune, your body starts producing cells, attacking cells on its own. So that is, again, it is based on genetic, and a lot of test is being done before putting a patient on immunosuppressants. Why? Because your immune has become reactant. आपका immune आपके जो बॉडी की इम्यूनिटी है उसके अगेंस्ट ही काम करने लगा है, मतलब आपके बॉडी की योर द रोल ऑफ दैट इम्यून सिस्टम ऑफ योर बॉडी इज टू फाइट अगेंस्ट दैट allergen particle. But if it is fighting against its own cells, then it's a matter of concern that autoimmune thing has set in. And because of that autoimmune thing which has set in, it is eating your cells and so what exactly is the role of immunosuppressants? To because wo aapki immune system has become hyperactive. So to make that hyper thing hypo, to make it come under control, that immunosuppressant thing is being prescribed. Are we done,
Okay.
Shabnam?
No, one more question. Dr. Syed is asking, in market scar removal cream, which is popular, contains steroids. It can suppress it or cure?
So you have to look out for the composition. A lot of scar creams, although much of them doesn't contain steroids, but it can contain also. So that is important to check out for the composition. So as if you are if you have to look out for ki by scar, what is the exact cause, what is the exact physiological phenomena why that scar has built up, whether it has built up due to more melanin production, whether it has built up due to wear and tear of the skin, whether it has built up due to skin burning, whether it has a build up due to more amount of sun exposure. So although a lot of scar amount of creams can contain steroids, so you have to check out for the composition.
So one last question. Should skincare and skin products should be different for men and women? Why or why not?
See, basically skin for women and men, it all depends upon the genetic composition. And basically it can be, it doesn't matter that it should be different for both men and women. Because nowadays you see that even men have started using cosmetic products, especially in the media industry, social media industry, and a lot of actor and actress. They are going for the same treatment, which even the female actress and a lot of influencers are being going on. So it doesn't matter that it should be different, or it hardly matters. It is same, but as you told that what exactly is the skin care? Skin care starts from within. Skin care doesn't start with applying all that cosmetic products. You get your eat a good diet, you have a good amount of sleep, you have a good water intake, you quit all the addictions, you do daily exercise, your skin starts to heal, your skin starts to generate, and everything comes into play. And then the secondary, you can use all that things for sunscreen can be used, even retinols and all that thing which can be used. So it doesn't matter, it should be different, it hardly matters, it shouldn't be different, but it starts from within by self healing of the body, not by just applying things over and onto your face.
Dr. Shibashish is asking, can you suggest any treatment for this? They have shared the screen he has taken. They are sharing the photos in the chat box. Dr. Ayush, if you
See,
can
this
check.
has to be once physically evaluated, because as I already told, I've seen this image. I think you asked the question. So this has to be physically evaluated. What exactly is this cause of hyperpigmentation? Whether it is through continuous skin exposure, sun exposure, whether is there any inflammation or infection which has set in. So we need to run a couple of tests to rule out what exactly is the cause. And then we can come out, once we know the cause, then the treatment can be prescribed accordingly. Just by seeing the image, it is very difficult, and any of the doctors also claiming कि भाई मैं देख के treatment बता दूंगा, then don't fall into that trap. Get yourself a physical evaluation done. Get to know what exactly is the cause of this. Just by seeing a blackening of the skin, it can be caused due to 10 to 15 factors. So you have to rule out what exactly is the factor which has caused this thing. And then we can start the treatment accordingly.
So Dr. Shrishti is asking, how do we know if we are overdoing our skincare routine and aging our skin faster?
See, basic skincare routine is maintaining a skin hygiene, maintaining your body functioning properly, eating a good amount of diet or so. That is more important. Overdoing is applying more amount of cosmetics, all that products you are using, you are using everything onto your skin without the knowledge, without the consult of the doctor, whether it is needed or not needed. So if you are using it, even if your skin doesn't need it, you are definitely overdoing it. जब जरूरत ही नहीं है, why I will take? I don't have a fever. I will start eating paracetamol on a daily basis. What's the use? Matlab, I'm just damaging my liver then because it has a side effect on liver. So if your skin really needs that products or no, if it needs, yes, go for it. But if it doesn't need, then why to take it?
Sir, any natural remedy to decrease internal
I have
inflammation?
already, I think, told this in the previous questions. I've
Yeah.
already told and I've already covered also in my slides.
Yeah. I guess we are done. Thank you so much, Dr. Ayush, for this insightful session. I personally learned a great deal, and I'm sure all the doctors here would agree with me. On behalf of everyone, I extend our sincere gratitude to Dr. Ayush. Actually, it's this kind of engagement and participation that motivates us to organize more such webinars in the future. So thank you
Thank
all
you.
for
Yes.
joining us today. Thank you, Dr. Ayush. We hope you found this webinar informative and valuable. So if you have any further questions or would like more information, please feel free to reach out to us. And don't forget to follow us on social media and WhatsApp channel for updates on future webinars and events. I'll be pasting the certificate link again in the chat box. Please do fill and get your certificates on your mail ID. Thank you so much, everyone. Thank you so much, Dr. Ayush.
Thank you so much, Shabnam, and thanks to Team Mediversal for conducting of this webinar. Thank you.
Thank you, everyone. Please do fill the certificate form. I have shared it once again in the chat box.